Should everyone be wearing a mask in public to help halt the spread or at least slow the spread of the coronavirus? I'm Dr. Brett Scher, the medical director at DietDoctor.com. And I've got to be honest with you. When we started talking about writing a piece about wearing masks in public, I thought, I'm not sure if that's our role at Diet Doctor. I'm not sure if that's really the topic we should be getting into. But the end result by this piece by Ann Mullens, I think, is fantastic, and I highly recommend everybody read it. We can't say for sure. We're dealing with such incomplete evidence, and the quality of evidence is so spotty. But the message about masks is really confusing, isn't it? Clearly, if you have symptoms, if you're coughing, and if seems like you're sick, of course you should be wearing a mask to protect others. But as we learn more about this virus, about how it's transmitted through the air, about how far these aerosolized droplets can travel, really makes you think. And then when you look at that graph that we have posted on at DietDoctor.com about the countries who really have sort of stemmed the tide in the rise of the coronavirus, one thing they have in common is it's more socially acceptable and more common for people to wear masks. Of course, that doesn't prove that the masks are what did it. They have completely different governments. They can regulate how people move about with greater severity. They can track people's cell phones. They have just stronger policies in place to keep people home. So that may have something to do with it. But now even the CDC is starting to change their message about masks. And, the post by Ann, I can't do it justice in this video. So I recommend everybody go to DietDoctor.com to read it because she really does a fantastic job. And the other important point she makes, though, is not to go out and buy the N95 masks and the surgical masks because the healthcare providers need those. Leave those to the healthcare providers. But boy, there are ways of making homemade masks I had never even thought of, using pillow sheets and bandanas and coffee filters and tea towels and vacuum cleaner bags. And she lists all those with links to videos on how to do it and articles. I think it's really interesting, and I learned a lot from the article. I'm so glad that Ann wrote it. And also about the stigma. There's such a stigma, at least in the United States and in parts of Europe, that if you're wearing a mask, you're doing something wrong or you're sick and you should be home. But now maybe that's starting to change, and I think it's so interesting that the culture really is going to have to change, and how the recommendations, if they start coming out more strongly, which it looks like they are, that we should be wearing masks in public for the next few weeks, months, who knows, that culture is going to have to change. And then she talked about the experience of the Czech Republic, which was really interesting. And of course, how to make a mask. So in the end, even though I was hesitant about us diving into it, I think it's an important message that's starting to turn. The tide is turning, and it's not completely settled. We don't know that wearing masks is going to definitely reduce the spread, but it seems to suggest it will, as long as it doesn't give you a false sense of security and prevent you from doing all the other things that are still so important, like social distancing and washing your hands, as long as it's not so uncomfortable that you start touching your face even more, and as long as you take it off and put it on in a correct, sanitary way to reduce touching of your face. So those are all important caveats there. But if you want to learn a little bit more about it, even if you're on the fence or if you're against masks, I encourage you to read Ann's post because I think it's a well done, well thought out post. All right. That's it for today. Be safe, be healthy, take care of yourself, and take care of others.